Good afternoon, and welcome to our webinar and SHIELD, our comprehensive COVID-19 testing system. I'm Melissa Haas, Associate Director of Federal Relations for the University of Illinois System, and I'll be moderating today's discussion. As you may have noticed, today's webinar will actually be part of a series that our Office of Governmental Relations will be hosting throughout the year to showcase various U of I system innovations, initiatives, and capabilities. For those of you who may not be familiar, Altogether Extraordinary is the U of I system's tagline to capture the profound impact that our three universities have on the public good. Our SHIELD testing program has been an incredible point of pride, so we thought it'd be fitting to kick off our series with a deep dive on how it all began, how it's evolved over time, and its overall success in safeguarding our campuses against COVID. We've got a really great lineup for you today that includes three individuals who have been on the front lines in getting SHIELD off the ground and scaling it up. After presentations by each of the speakers, we'll transition to questions. During the presentations, please feel free to share any questions that you have in the Q&A box, which we'll be continually monitoring. Now, it's my pleasure to introduce our first speaker, Susan Martinez. Dr. Martinez is a biochemistry professor and the Vice Chancellor for Research and Innovation at the University of Illinois, Urbana-Champaign. In this role, Dr. Martinez oversees the university's safe, ethical, and productive conduct of research, a nearly $700 million enterprise that powers our nation's economy and keeps our people safe. Her office has been instrumental in building on the scientific innovations that underpin the university's COVID-19 response. Susan, can you start at the very beginning by telling us how the idea behind SHIELD first emerged and how Urbana's research enterprise was able to quickly mobilize after the pandemic hit?
Yeah, absolutely, Melissa, and thank you for that nice introduction. Before I do that, I just want to thank those of you who are here today for taking some of your time, and also for all the hard work that you do supporting the state of Illinois, higher education, and also the research enterprise that we're going to talk about today. Here, as you can see, meeting the COVID-19 challenge, how University of Illinois at Urbana-Champaign and the University of Illinois system rose to the occasion. And the answer to that is research universities. Research universities are uniquely equipped to meet challenges. This is what we do today, this is what we've done yesterday, and this is what we'll do in the future. Though the pandemic may make campus feel a little bit quieter if you come to Champaign-Urbana and our other campuses, I can assure you that every member of our research enterprise is working harder than ever, whether on site under COVID safety precautions or remotely, to address the pressing challenges that face society. Next slide, please. You know, research powers our success as a university. And even during the pandemic, we are hard at work, again, safely. The university's COVID response is really a research enterprise response. Our bench is very deep, and I don't think anyone has the breadth of excellence that we do right here in Champaign-Urbana, whether it's in engineering or computation, chemistry, biology, agriculture, social sciences or humanities or the arts. This is what we do, and we work well together. If you combine that with a roll up your sleeves and just do it, Midwest work ethic, and our research is absolutely thriving in spite of the many, many challenges. Students just don't come here for a traditional college experience. They come here really to work with those people that are driving the research enterprise, to train, to learn, to prepare for careers. These researchers are among the best in the world, and they develop, you know, the next frontier of innovative people that are going to go on to change the world. And that is unique among public higher ed in Illinois. You can see some of the tools and approaches and methodologies that we developed on this campus, whether it's our SHIELD operations that you'll hear a lot more in a few minutes from Professor Marty Burke. When the NIH came to us to ask to run a clinical study that would look at the viral dynamics of COVID-19 and new COVID patients that had just begun isolation. We had technological innovations where we produced out of our College of Engineering a new, really easy to construct and effective vent system that we called the Rapid Vent. Our computational firepower at NCSA produced and organized a consortium across the nation that we called the COVID-19 HPC Consortium that could dispatch computing time to help understand and manage the COVID pandemic. We've developed mental health resources through interdisciplinary work across the social sciences, the humanities, and our medical people. And we also develop courses to educate people on the pandemic. You know, the nation is really watching our research enterprise. And one thing I'll say, it's not a time to cut back, but it's rather a time to capitalize on what we can do and double down on our university and its research enterprise and its educational missions. Next slide, please. So we're showing the nation a way forward in our response to this pandemic on campus at a time when we've done well over 1 million tests on campus that has driven our positivity rates amongst the lowest, if not the lowest in the nation. And in partnership with the federal government, we can show the way forward on COVID-19 and so many of the issues that challenge our nation right now. We have great reason for optimism. In the coming decade, we can harness the true power, the understanding of the human genome. We can revolutionize and automate crop production. We can grow our fuels instead of drilling for them. It is possible, but it requires a bold vision and a commitment to basic scientific understanding. Here, as we move back to normal, on what we see is hopefully the backside of the pandemic soon, we'll have acquired millions of samples and data in a repository that we can share with the world to understand not only COVID-19, but also the pandemics that are in the future. We've sponsored RADIX projects along with the NIH that are looking at clinical dynamics and social factors, and also translating commercial applications so that people outside or companies outside society can take advantage of what we've learned at the University of Illinois at Urbana-Champaign. We're looking at vaccine studies. We're taking all these in the context of health disparities. We're keeping our communities safe by innovating throughout the pandemic. On the next slide, it's soon coming to a time when we'll need to rebuild our communities and our nation after the pandemic. The University of Illinois looks very forward to being a huge part of that solution. With investments in our university's research and innovation ecosystems, our investments in the state and the nation. Research creates good paying jobs in the community, not only technical jobs, but the support jobs that go along with that. Our Prairie Research Institute, which serves the state and is housed under my umbrella at the University of Illinois, helps keep safe water resources, pushes forward transportation projects, manages climate data in ways that farmers can use. We've developed a coal ash response team and many more. There's also tangible examples at our thriving research park, which has over 120 companies, including an incubator that allows new companies to get an outstanding start in commercializing and developing their innovations. We have a brand new Illinois Conference Center that is hosting vaccinations for the county, one of the best performing counties in the state for efficiently using the vaccines that we have at hand. Again, I want to thank you for being here today to hearing parts of our story. I'm looking forward to hearing your questions and thinking together about what comes next. Thank you, Melissa.
Thanks a lot, Susan. I'd like to now introduce our next two speakers at the same time, since they'll be presenting together. The first is Marty Burke, who wears many hats, but he's a professor of chemistry who also serves as the Associate Dean for Research for the Carle Illinois College of Medicine at Urbana. Dr. Burke has been the leader of our impressive SHIELD team, which involves multiple researchers and students from across the university. He helped design the test and can explain in detail how the test and overall system works, as well as how it's been such a breakthrough. Our final speaker is Jay Walsh, who is our Interim Vice President for Economic Development and Innovation for the U of I system. Dr. Walsh's office leads initiatives in support of the university's economic development mission to ensure that innovations grow beyond the university and into the private sector through a pipeline of idea acceleration units and connected partnerships. In addition to overseeing the clinical studies for our saliva-based test, Dr. Walsh has also overseen SHIELD Illinois, an internal unit that was developed to extend the testing program and infrastructure to institutions and entities across the state of Illinois. Marty and Jay, the floor is yours.
Great. Melissa, thank you so much and welcome to everyone, and thank you for the opportunity along with Jay to share a bit of our story, and we're very excited to have the chance to do so. As Susan mentioned, when the pandemic struck, we looked towards our strengths to see if we could make a difference, and our land grant mission inspires us to seek service of the public good, and we saw that we had an opportunity to do something obviously during a very challenging time. So per Susan's charge, we rallied a team together. The mission was stand up and strategically deploy fast and scalable testing to help keep our community as safe as possible as we plan to reopen in the fall. We called this program SHIELD to reflect a primary focus on safety and keeping our community safe. We also recognized that testing was going to be critically important, but it was not going to be a silver bullet. So we called this our Target Test and Tell program to reflect what the science was teaching us early on, that you had to take a comprehensive multimodal approach if we were going to be successful. And the last, we put the big bold I right in the middle, because in Illinois, we love to innovate and we get along. And this was a way for us to take advantage of that very rare, powerful combination of strengths and decide we were going to do something and try to go on offense and see if we could make a difference. If you could click the next slide, Melissa. So just to emphasize a bit, this multimodal nature of our approach was critical. We brought in our epidemiologists and computer scientists and frontier modeling team, in names I'll introduce as we go along the way, to take the very best data science and computer technology we had access to and to model, to predict what was going to happen in our community with different interventions in play. And this played a critical role in helping us design and ultimately execute and dynamically optimize our testing program. Right in the middle, we knew we were going to have to create a test that was much better than was available at the time. Many on campus had teamed up with our local hospital to try to help get nasopharyngeal swab testing stood up. This is all the way back in March and April. And it was clear that this was not going to be sufficient. Our modeling team had told us we needed to test everybody twice a week, 50,000 people twice a week, and we couldn't come to a way to put 100,000 nasopharyngeal swabs in play over the course of even 1 week, much less throughout an entire semester. With Paul Hergenrother at the lead and so many others, we were able to innovate a new way to detect SARS-CoV-2 using readily available saliva that could be used over and over again. It's non-invasive, doesn't require healthcare workers, and was going to be compatible with very large-scale surveillance testing. And this is now the COVID SHIELD assay, which I'll describe in a bit more detail. And last, we recognized in order to make all of this work, we were going to have to compel compliance, and ideally through a positive enforcement. And so we came up with this do-to-do model. The idea was, I'll do my part so that I can do whatever it is I really ultimately want to do. And Bill Sullivan and his team at Rockwire created a new app called Safer in Illinois that allowed us to connect the dots between the testing program and the capacity to participate in classes, in research, going to the gym, going to the library, et cetera, all of this being coupled through the app. We also have digital exposure notifications, which are actually frontier, kind of proximity-based and privacy first. All of this together created the SHIELD platform. Next slide. Just to highlight a few of the outputs of the modeling teams, this is our target team, quickly showed us this multi-layer approach was going to be critical. And just to highlight a few of these data points, R naught is how well the virus replicates. If an individual gets affected, how many other people are they going to affect? This is why SARS-CoV-2 is so difficult. The R naught is around 4. That means each person infected, if you do nothing, they're going to infect 4 others. If you just test frequently, you have a big effect, but it's not enough. If you just wear masks, you have a very large effect. Masks work, but it's not enough alone. If you simply combine the masks and the testing, now you get down to a much more manageable level. And if you then include things like large classes online and contact tracing, now you beat the odds and you get into a position where you can control the pandemic. This is, of course, what we were targeting, and we knew we'd have to get there with a multi-layer approach. Next slide. We also modeled what was going to happen across our campus if we did different aspects of this multi-layered approach. And ultimately, we settled on a highly interdisciplinary and multimodal approach, which involves twice per week testing, initially of everyone, masks being required, classes greater than 50 online, as well as both manual and digital contact tracing. And this was ultimately the strategy that we deployed when our undergraduates came back onto campus. And the prediction is that we were going to get a bump because the undergraduates were going to bring cases back with them. but that Shield would ultimately be able to drive those cases down, and that we would hit a dynamic steady state, maintain a good low positivity rate, and keep our campus safe. Next slide. So one of the key aspects, as mentioned, was we needed a new test because the supply chain bottlenecks, the cost, the lack of convenience, the lack of compliance, all of these issues made it, in our mind, impossible to do what we wanted to do with nasopharyngeal swabs. And so at the leadership of Paul Hergenrother, an entire team was launched. We called this initially our Manhattan Project, but it quickly became the Champaign-Urbana Project. So from May to June, all out full court blitz, just tremendous innovation. And when all the dust settled, the team tried thousands of different possible ways to do this and found a remarkable result that's very simple. Human saliva can be heated at 95 degrees for 30 minutes, transferred into a buffer and straight to the PCR. And so this is a very powerful discovery that allows a direct, without RNA isolation, detection of human SARS-CoV-2 in human saliva, the first discovery that was even possible. And this was the backbone for what is now the COVID Shield assay. Importantly, this requires no healthcare worker, it's non-invasive, it's easy to collect, and we can get the results back in hours rather than days. The level of detection is very low, on the order of 500 to 1,000 copies per mil, which allows us to detect people at the very early stages of infection, as we'll show. We published a preprint showing this work early on in June, and this has been very influential and impactful all over the country and the world, having others use the same assay. Next slide. I'll hand it over to Jay Walsh, who has been leading the charge to test this assay clinically.
So the laboratory scientists developed this new test and showed in the lab that it worked phenomenally well. The question was, would it work in a clinical environment? So there was a number of studies that were designed, and the one that is shown here and that was brought to full fruition was a study that involved a collection of samples from the nasal region, a mid-turbinate nasal swab, and compared that with the results from the saliva samples that were collected simultaneously. These were done at two clinical sites in Chicago, as well as one of the collection sites on campus in Urbana-Champaign, as well as with collaborators that we were working with at the University of Wisconsin in Madison. When all of the results were pulled together from those four sites, the mid-turbinate swabs, which were considered the gold standard for this particular study, there were 31 positives from that study and 89 negatives from that study. Of those 31 positives that were found by the mid-turbinate swabs, 30 of those were also positive with the nasal, and only one of them was negative, which meant that the positive percent agreement was about 97%, 96.7%. On the other side, for the negative ones, the saliva was negative on 88 of those, and there was one of those that was positive, for a negative percent agreement of 99%, 98.9%. This is a phenomenal result and well within the expectations that the FDA sets out for a test that is validated for the detection of the nucleic acids within SARS-CoV-2, the virus that causes COVID-19. To show further the sensitivity of this test, next slide, please, a follow-on study was done looking at patients who had low viral loads. We were conducting on campus, actually, a test where those, and Susan mentioned this earlier, where those who had tested positive for the virus agreed to be part of a study where they daily did nasal swabs and a saliva sample, provided both of those. And we compared those, and in this graph, we compared those for only those that had on the nasal swab low viral loads. So of those 17, in this case, there were 5 students who were tested. Of those 5 students, 17 of the nasal swabs were indicated low viral loads. And therefore, that's a difficult assay. That's a difficult level of virus within either the nose or within the saliva to detect. And of those 17 positive nasals, 16 of those showed up positive on the saliva. And indeed, the one that was missed, actually, we look at 3 different genes within the SARS-CoV-2 virus. One of those genes actually showed positive. This, again, is a fantastic result, indicating that the assay that was developed in the lab in May and June has excellent sensitivity even when the viral load in the patient who is positive is low. Next slide, and back to you, Marty.
Great. Thank you, Jay. And the reason why that last point is so important is our goal was to try to catch individuals that turn positive before they become infectious. And the literature suggests that the number you're looking for there is about 25. If the CT value, which is opposite of the viral load, if the CT value is above 25, that suggests that that person is not yet infectious, that their viral load is less than 1 million copies per mil. And so we've done a lot of studies to look at how the COVID Shield assay performs in the real world. This is just one snapshot of some of the evidence that gave us very early confidence that it could detect infections very early and could highly outperform antigen testing. So here's a group of individuals who were collecting both saliva and antigen tests every day. And as you can see, the blue lines indicate when they were found to be positive by saliva. The line turns orange when if they were eventually found to be positive by antigen. So this, for example, means this person was found to be positive by saliva at a CT value that was prior likely to being infectious, but they were not identified on that day by the antigen test. Similar thing here, identified by saliva, and then only 3 days later did their antigen test finally turn positive. Here's an individual detected again with very low viral loads, never turned positive by the antigen. We have multiple situations like that, or in the antigen test, they turned positive only days later. It's a very unique data set because we were testing everyone so fast and frequently to really kind of see head to head in the real world how the COVID Shield assay compares to the antigen test, giving us very strong confidence that this was actually going to be a superior and highly effective way to catch early infections and likely prior to infectiousness. Next slide, please. So this slide gives me a chance to introduce you to 2 extraordinary team members, Paul Hergenrother and Tim Fan, as well as Lei Wang, Rich Fredersen, and an entire team at the Veterinary Diagnostic Lab. You may have heard back in February, there was a tiger at the Bronx Zoo that had been diagnosed with COVID. That happened here at the University of Illinois by Lei Wang and his colleagues at the Veterinary Diagnostic Lab. And when the pandemic struck and we needed to find a way to scale up COVID Shield, we partnered with veterinary medicine, and they actually allowed us and partnered with us to turn the VDL into a human COVID-19 testing facility. It's now 6 rooms, 3,000 square feet spread out, among them stacked with robots and all the equipment needed, 6 thermocyclers to create an absolute engine for COVID testing. And there are days during the semester we performed in our lab more than 15,000 tests per day, which was actually more than 2 to 3% of all the tests in the entire United States on those days. So it just turned out to be an amazing engine. Again, great thanks to the VDL for helping us pull this off. Next slide. So you may ask, how do you test 20,000 students, faculty, and staff per day? So here's a collage to try to answer that question. So we had the engine running at the COVID lab. We set up about 40 testing lines all across campus. You can see about 20, each with 2 lines, 20 stars all across campus. Most of these, at the beginning, were large outdoor tents. You couldn't walk to class without walking by one, so hopefully make it as easy as possible. You simply scan your iCard, you get a tube with your name on it, you dribble in your saliva, it goes in a rack, and then we've got golf carts running those racks down to the COVID lab on the hour. You can see some shots here of the whole process in action, and then these are some of the shots inside the COVID lab with the robots. Much of this is now fully automated with some people handing off between robots. The average turnaround time after 1 million tests over the course of the semester was about 11.2 hours. The same time period in the US, the average turnaround time was in the order of 2 to 3 days, sometimes up to 7 days. Next slide. We also, as I mentioned, created an app called Safer in Illinois. This was Bill Sullivan, his team at Rockwire. And this is really one of the key features. There's a screen on the cover where if you want to gain access to any building on campus, you have to flash your app and show that you have access granted, as shown here on the left. that means you're up to date on your testing and you're not positive. If you've missed your test or you've tested positive, you flip to an X and you can't gain access. This was critical to help us gain safe classrooms, safe laboratories, and safe university community. And actually the bars and restaurants picked this up. If you want to go grab a beer at Joe's Brewery, you have to flash your app now. So it turned out to be a great way to engage with our community and this do-to-do model brought to life by this really creative app. Next slide. Okay, so very quickly, I just want to tell you the story, how things played out over the semester. And in the interest of time, I'll move quickly, but I'll be happy to answer any additional questions. This is a shot of our dashboard, which many of you may have seen. This covers from July 6th, where we initially launched our pilot, all the way to December 23rd, when we officially closed down for the end of the semester. And you can see there's a lot of rich aspects to the story that we'll dive into a few of them. During a pilot period, we saw some very strong evidence that this assay could drive down positivity rate amongst a test of volunteer participants. So we got a lot of good confidence. Our undergrads came back and we had originally, just as we expected, a small bump. And then, as I'll mention, we had a surprise. Okay, so there was an unexpected spike in cases from our undergraduates, but with some fast changes directly driven by the data analytics that we had at hand and the power of the COVID Shield assay, we were able to drive that right back down. We hit a really nice dynamic steady state, ended down at 0.05 by mid-October. We had some interesting challenges with rising cases in Champaign County, which we were able then to mitigate with our Shield surge, as we called it. We had a bump after Thanksgiving, and then we drove that down again, and we ended the semester at a positivity rate of 0.16%. As I'll emphasize, some of the most important aspects is across the entire semester, as I'll show with the data, we have no evidence of spread within our classroom, no evidence of spread in our research lab. We have no evidence of spread from our students to our faculty of staff, and we looked in many different ways, and we've now shown we did not transmit from our UI/UC community to our surrounding community. If anything, it happened the other way. And so I'll show you all of the data to support this. Also, of course, critically important, throughout this entire time period shown here, we had no hospitalizations and no deaths from COVID-19 amongst our UI/UC community. Next slide. So just very quickly, the summer pilot, we saw a nice mix of undergrads, grads, and faculty and staff voluntarily participate, a total of about 17,000 people. We learned a tremendous amount about how to collect saliva, how to encourage people to make sure their samples are homogeneous, how to actually make them much more amenable by switching our time to 60 minutes prior to delivering samples as opposed to 30, et cetera. And we watched our numbers come down from a positivity rate, very much encouraging us and giving us a lot of confidence going into the semester. Next slide. Then the students came back, and we had predicted we would get about 300 cases based on the positivity rates around the country of where our students were coming from. We saw almost exactly that, okay? And you can see this pie chart tells you where the cases were now coming from. Most of them, of course, now were coming from undergraduates. Next slide. So we had predicted this was going to come right back down, but we saw, unfortunately, a challenge that we got a spike. And this was a surprise. And we had all the data analytics running, and we had the Shield assay up and running. So the most important thing is we were able to see it and we were able to respond to it because of that powerful engine that was in operation. And so the data told us that, in fact, your cases were coming from our undergraduates, and we also had all the data on where parties were happening, and we had a lot of data on who was testing positive and whether they were staying successfully isolated. The bottom line is we have amazing undergraduates at Illinois, as many as you know, and the vast majority of them were doing their part. The problem is there was a small minority who unfortunately made some really bad choices, and we had people who knew they were positive who either went to parties or hosted parties. And this was directly then correlated with the spikes, even down to the proximity of where those spikes happened. And so we got a spike, but we saw it and we were able to make changes because we knew everything that I just told you in real time. So we did three things. Number one is we knew the undergrads were having the hardest time. So we started testing many of them 3 times a week, the rest twice a week, and we backed everybody else off to once a week so we could prioritize test the undergrads. We also instituted essential activities only. Undergrads could still go to class, they could go to the grocery store, they could exercise outside, religious activities, but that was it. Otherwise, they were asked to limit socialization. And then the third thing is we saw an opportunity to help get them safely isolated faster. So we were working with CU-PhD, who's been an amazing partner throughout this whole process, but there was still a delay time between when we knew they were positive and when they were getting safely isolated. So we launched a new team called Shield Team 30, Stephen Bryan and his team at the Dean of Students, so that we would try to get everybody safely isolated within 30 minutes of a positive test. Turns out we actually ended up getting down to 5 minutes of contacting them based on a very creative text messaging strategy. And so this also made a huge difference. Next slide. So as you can see, this worked. So we went from a very challenging situation, which if you mathematically model this, we would have taken off and exploded to 30,000 infections. And instead, we brought it right back down. So we saw a dramatic impact of the SHIELD program. We were able to bring these numbers down, ultimately release the essential activities only, reopen many of the things back up, keep driving the numbers down, and we ended up at 0.05% on October 17th. Next slide. One of the things to highlight is that during this time, we were tracking CT values, and in fact, more than 70% of the initial cases had a CT of greater than 25, consistent with most cases we were catching people early. And so this actually was a very powerful weapon that we could apply in lots of different ways. Here during kind of late October and then in November, we had a different challenge. We had rising cases, but now it was not just the undergraduates. We saw it amongst all of the groups. And we also saw this correlated with the Champaign County numbers. And so we knew we were going to have to treat this different problem with a different solution. So we started actually putting everybody back on twice per week testing. We ramped up the amount of tests performed. And again, we were able to drive our numbers right back down. Next slide. We then finished the semester. We had a Thanksgiving bump, which we attributed to socialization over the holiday. We were able to put everybody back on twice per week when they got back. And you can see we drove the numbers back down. We ended the semester at 0.16% as the official last day of classes ended. And this overall ended up being a very successful mitigation of transmission across our campus. Next slide. As highlighted, we've taken a lot of different approaches to try to understand how well did SHIELD actually work. And there's many different ways you can ask this question. I'll just show you a little bit of data here from Nigel Goldenfeld and his team. Kind of the frontier model is on the target team. And you can look at our R naughts over time, a 7-day average. You can see we had those bumps that I articulated, but then we were over and over again able to bring it right back down. And so often getting it down below 1, so we got down to 0.5, et cetera. So really nice evidence that the SHIELD was able to actually continually push back against the viral spread and get ourselves into a good dynamic steady state. Next slide. We also looked via correlation analysis to ask whether or not we were transmitting to our community or whether our students were transmitting to our faculty. The bottom line answer is that what we've seen is that we see none of that. So the correlation tells us, as you would expect, we end up actually seeing correlation between our faculty and what's going on in the county. And this is as expected because all of our faculty live in the county, and that's what that correlation would look like. When we look for correlation between our undergraduates and our faculty, now we don't see it. They're actually not correlated. When we look for a correlation between our undergraduates and our local community, we don't see it. And so correlation analysis strongly supports that we were able to stop the spread from inside out. Next slide. Another line of evidence that supports this, Becky Smith, kind of top epidemiologist on the team, and her postdoc, Johnny Uelman, have done a very interesting analysis now with all the data from the fall across the entire country. They looked at counties without a university versus those with a large university, greater than 20,000 students. And then we looked at Champaign. And there are two really striking results. The first is relative to either counties with or without a large university, we see more cases identified in Champaign. This is consistent with we're doing more testing and therefore we're identifying more of the actual cases. Next slide. The most important and my favorite piece of data is this one. They then looked at the age-adjusted COVID-19 related mortality rate in Champaign County compared to those other two groups. Unfortunately, what's seen for universities that didn't have SHIELD is that when you compare counties with no universities for those that with universities, there's actually about a 25 per 100,000 increase in COVID-19 related mortality. So you see the effect of having a large university in counties when you look across the whole country. Champaign County looks like a county that didn't have a university. So our COVID-19 rate is actually lower than that of a county with no university. We didn't see this bump. This is the strongest evidence we have that we successfully mitigated against spread from UIUC to Champaign County. Next slide. So just to summarize, all of this has taught us many things that we have been sharing with the world, and it's been very impactful in context far beyond our own campus. We've now shown that fast frequent testing can work to mitigate spread in a large university community. We were able to keep our case positivity less than 0.5% for the most part. We had no hospitalizations or deaths amongst our own community here at UIUC, no evidence of transmission in our classrooms or labs, no evidence of transmission to our faculty and staff from our students, and our evidence is consistent that we mitigated spread from UIUC community to our surrounding Champaign. To emphasize, testing is not a silver bullet. It has to be integrated into a holistic approach. Most initial tests were people who were asymptomatic or minimally symptomatic, so kind of a key indicator how important that is. The COVID Shield assay itself performed brilliantly on large scale, so more than 1 million tests. Some days we were performing 2 to 3% of all the tests in the US, and we had test back results in hours, not days. Data was a critical part of this, dynamically allowing us to tune as we go to maximize impact. We knew we had to get people isolated fast and safely. We also did a lot of work on trying to help people socialize safely because pandemic fatigue is real. And so we've spent a lot of time working with our students as our partners on that. And we've made changes to the spring that have already made a positive impact. So we wanted to avoid that spike. So we actually brought our undergrads back in stages. We and it worked. So we mitigated against that spike this time. And the last thing I'll just mention is that fortuitously, our assay detects for B117, at least initially, automatically, because we test 3 genes and the S gene is dropped out if you have B117. So this has allowed us to track this, and now we've confirmed by sequencing that it is on our campus, but we've been managing to keep it under control, and that is the goal as we try to get everybody vaccinated. I'm going to stop there. Thank you so much again for your attention. Of course, we're happy to answer any questions.
Always so impressive. Thank you, Marty and Jay. All right, we're now going to move into the question and answer portion. And just as a reminder, if you have any questions for our panelists, please go ahead and submit those through the Q&A box. We do have one initial question that has come through, and that person asked, where were the students who tested positive isolated? And I think this would probably be a question for either Susan or Marty, whoever wants to take it.
I'll start and then Marty can fill in if he likes. So we first of all, isolation and quarantine are done in partnership with the Champaign-Urbana Public Health Department, which we have an exceedingly great relationship with. We set aside a number of dorm rooms to accommodate this. We thought about this beforehand. We had Nigel's predictions and could really set aside adequate numbers of those. We also set aside hotel rooms in the Alumni Union, which is our hotel on campus. And then the CUPHD also provided off-campus hotel rooms for those in apartments. Students in apartments could stay either in the dorm rooms or also in hotel rooms if they didn't have a way to isolate. So I don't know, Marty, if you have anything else to add to that.
Yeah, no, that's great. And we're working more and more to try to help students isolate on campus as much as possible, because data suggests that they do a better job when they're on campus, but some of them choose not to do that. So we've been working very hard with CUPHD, as Susan mentioned, to try to maximize compliance while still working within the complexities of all of the different wants and needs for the student body. Our focus has been to try to support them as much as possible while they're in isolation, and therefore help them succeed in staying isolated and helping keep people safe.
And let me just add one more thing to that. We've realized that mental health, as everyone's realized, is really at a premium right now under the weight of the pandemic. And we launched a mental health task force in December after we realized our positivity rates were coming down. We could focus on a lot of other things in a more deliberate way. And we're going to be rolling out some plans on campus to really help students, faculty, and staff cope with all the mental challenges of the pandemic.
Fantastic. Thanks, Susan. From the very beginning, we've been very pleased to see that NIH had launched its Rapid Acceleration of Diagnostics initiative, also known as RADx, to speed up innovation and the development and commercialization of COVID-19 testing technologies. I know Urbana has gotten really strong support from the RADx program. Susan, can you expand a little bit on some of the things that we're doing with the RADx suite of programs? I know there's a few of them, and why we've just found the model to be so helpful.
Yeah, and I'm really grateful to my colleague, Vice President Jay Walsh, because he really helped us connect with the NIH RADx program. I believe it's about a $2 billion investment from the federal government. And that connection, first of all, helped us with our commercialization efforts through the system Shield T3 and Shield Illinois, which Jay has been really connected to, and help us translate our innovative saliva testing to the outside world, and also set up a playbook for K through 12. When the NIH saw what we were doing on campus and at the scale we were doing it, they came to us to ask if we could set up a study with our isolated and quarantined patients to catch the virus very, very early and follow its dynamics to understand how the rise of fall of the virus in patients. We've collaborated with Johns Hopkins on that through the NIH and also University of Massachusetts. Another study that has developed through the RADx program is a social and behavioral study that monitors risk factors that would make people particularly prone to becoming infected with COVID. And I don't know, Jay, if you have anything to add. I know you've spent a lot of time with the RADx team who's helped you with some of the other regulatory issues around our test.
Yeah, the RADx team has been absolutely vital for us in a number of ways. As we move this forward and try to move the test beyond the campus, there's a need for us to work with regulatory agencies, in particular with the FDA and NIH through this RADx team, which stands for Rapid Acceleration of Diagnostics. Through that team and that regulatory team, we've worked with them to move forward with the FDA. And we're much, much closer now to having authorization to move the test beyond the campus in a way that will have real impact. And the RADx team has also helped work with us to line us up so that when we get that EUA, we are ready to really move things forward very rapidly. And as Susan indicated, they've also worked with us, in particular with Becky Smith on the K through 12 playbook. That's also been a collaboration, not only with NIH, but also the Rockefeller Foundation, who has graciously funded us to look at testing in the K through 12 environment. So Becky has worked with RADx team and with the Rockefeller team to develop this playbook, and Becky has now become one of the national leaders in that space.
And Melissa, they're also talking with us about setting up a vaccine study in our young adults too, which is really, really exciting. We're hoping to catch it before our young adults escape for the summer.
Yep. Wonderful. That's good. And I guess piggybacking a little bit off of that, there's a question that came through that asks about Greek life. And they're wondering, did Greek life prove to be a large spreader? And if so, how did you manage it specifically? What are some of the actions that we took?
Marty?
Reactive.
Yeah, so the answer is yes. We saw a disproportionate amount of transmission and cases in both fraternities and sororities. And some of the private certified housing for which the percent of the population that is participating in fraternities, sororities is generally higher. So the facts are yes. That said, again, it's a mixed bag because the majority of our fraternities and sororities were fantastic. So as you know, we have a great relationship as a campus, and many of them actually are some of our best student leaders who actually stood up and said, let's lead on this and let's make sure that we can show the way. There was so much of that happened, which is why we were all so upset and of course not happy when the very small minority of those fraternities and sororities made some really bad choices. It was the minority, but then the brutality of the math with COVID is that a small group can make a really bad negative impact. The beauty was because we had the data, we could respond, and we always tried to take the supportive approach. So we engaged, we reached out, we talked with the fraternity and sorority leaders. We had Zoom conferences with the entire buildings and tried to help them understand the implications and the consequences of the choices they were making. And in large part, it worked. There were so many cases where that type of direct engagement and partnership was very successful. And we dealt with challenges along the way, the minority of which, some of which required other outcomes, but eventually, as you can see, we were able to keep everything largely under control. Most of our students did a fantastic job.
And I will say there's always a silver lining. When you run into these challenges, new innovations come up. And I think that really drove this T30 program that Marty was, I think, your brainstorm, where we could get the message out via text. We discovered students don't pick up the phone. They need a text to respond. And within 30 minutes, and as Marty said, down to 5 minutes now, we set up an automated system so they get a text that said, you need to isolate now and we'll be following up. Please pick up the phone.
Great, thank you. The last question that we have here at the moment is, have we worked with DCEO, which is the state agency, the Illinois Department of Commerce and Economic Opportunity, and tourism, restaurants and hospitality to provide this data and plan for assisting to more open conventions, et cetera. So maybe Jay, if you could just start by talking a little bit more broadly about just our engagements with various entities and groups throughout the state.
Yeah, so we have worked with a number of agencies across the state to look to open up the economy. A lot of K-12 organizations, other public universities, and private universities as well. Actually, one of the universities that was involved in SHIELD from the beginning was a small private university in a small county in southern Illinois, Greenville University in Bond County. And they had very much the same result that happened in Urbana. Very few cases because they were caught early. So, you know, we did move it, and all that testing happened on our campus. So they brought their saliva up to Urbana. So we've proven that this can work. We're in conversations, as you mentioned, with a number of organizations, including, interestingly, we're working with. There's a group in Illinois that looks at summer camps for children. We're conversations with them about being able to test the children and the camp counselors, and frankly, even the adults before they leave, so that children can go to camps this summer, even if they haven't had the vaccine. So those conversations are happening. We haven't signed any agreements yet to do that, but Melissa, that's a great question. And yes, we're looking to fill the land grant mission in support of the economy of the state of Illinois and the people in the state of Illinois.
Wonderful, thank you. Susan, I know you and other senior research officers around the country collaborate on a regular basis and share best practices, and that's been especially true during this challenging time. What are some of the ways in which we at Urbana have contributed to discussions with peer institutions about managing the pandemic, including SHIELD?
Absolutely, Melissa. Well, I have to say, SHIELD in some ways was born out of that network as senior research officers out of APLU, the American Public Land Grant Universities, was figuring out how they could help, particularly at those campuses that don't have a clinical center, realized that you could set up testing at a vet diagnostic lab and you could use student health to actually prescribe the test. And once we realized that we might have a viable system, the provost went straight to Marty and asked him to lead the effort. So we're eternally grateful to Marty for that. But secondly, we compared research safety plans. We compared how things were going on campus, what was working, what wasn't working, how human subjects research was profoundly impacted. And even yesterday, group put out a call asking about travel. Who's allowing faculty to travel for research? And what are you considering essential research? It's been a very, very active group, whether it's been in the Big Ten, which is a very close-knit group, the AAU, America's leading research institutions, or the APLU.
Thank you. We have another question that I think we've covered a little bit, but maybe we can dive in a little bit further. Have we encountered any kind of conflicts or not been on the same page as far as our particular program and just policies, procedures locally? And I know we've been engaged hand in hand with our local entities, but how can local governments better support universities to help mitigate spread? And I guess I would expand that even further to the federal government too, because we've seen various proposals and funding that has been available for testing. And so maybe I can first throw that out to Susan and Jay.
I'd be happy to take that. So first of all, at a community level, prior to the pandemic, our chancellor and provost had worked very hard to build community relationships with our mayors, our elected officials. And the chancellor tasked me to start an economic development advisory committee with local business leaders that he and the provost attended routinely. So we already had well-working relationship and had already addressed issues and worked through issues. And we had a bout with, I think it was it measles? So we already had, and we had a well-established infectious disease working group, which had not only university people, but also county people, city people, and also the CUPHD, the Champaign-Urbana Public Health Department. So we had some very good working relationships that allowed us the platform as we found challenges, and local people and people on campus were very nervous about us opening up, not knowing if this would work or not, to talk through this. And we put Marty out in front of a lot of people to talk about this. We put Nigel out in front of a lot of people to talk about this. We worried about the bars and the restaurants, and together with our local mayors, we met with those business owners, and they did us some big favors by shutting down during critical weekends. And Marty, you were right there in the front. You want to talk about that a little bit?
Well, it was just an amazing partnership. So I think, Susan, your leadership, and honestly, I mean, Chancellor Jones and Provost Congilares, they just have such a relationship with the community that when challenge struck, I think, as Susan, you said, the foundations had been laid. So we were on calls with the mayors and the bar owners, and trying to think, how do we all team up together? This was in August, prior to our students coming back. And I think one of the most important things that happened, Susan, as you mentioned, there was a voluntary shutdown by our local bars and restaurants. It wasn't required by the state. It wasn't something that anyone else told them they had to do. They just agreed to do it in concert with the mayors, so that we were all investing in being able to stay open later. That was the pitch that we made to them, was let's do this now so that we can actually be open all semester. It was a hard sell, because this was their weekends. They were finally going to be able to start, getting the economy going again, but they did it. And to their credit, it made a huge difference, right? That spike that we saw would have been way worse if we didn't have all of that stuff in place ahead of time. So I think it's a really important point, Melissa, you're making. Partnerships and working together is so incredibly critical. The test is great, but partnerships are critical. I think that's really a lesson we learned.
And Melissa, if there's ever one point of frustration, it's when our positivity rates were way down. We were doing so well. We were an innovation hub, and we really wanted to be a center upon ourselves, and the state still had us with Region 6, and we went down on a further lockdown, and they pulled our testing data out of the numbers so they could really figure out what was going on with the rest of the county. So if there's ever a point of frustration after working so hard with so much buy-in, that might have been it. But overall, great working relationships. Jay, do you want to have any comments about the state or?
Yeah, I would just add that in Springfield, they had a very similar relationship. We haven't talked about the fact that UIC and UIS also were involved in this. So UIS, for example, they've been testing on campus and bringing their saliva to Urbana for running the saliva through the VDL. And they also had community challenges beyond the campuses. For example, the fire department there, those of you who might know, fire departments, the people sleep in the same basically barracks room, and it's relatively easy to spread the virus in that environment. And UIS worked with the fire department in Springfield to help mitigate the disease.
Melissa, I think it's really important for this group to also understand the importances of the agencies and their investment in research, federal sponsored research. The NIH RADx program, with that big investment by the federal government, was key to providing deep cores for us to access, and also the NSF. We already had a program called Exceed in high performance computing, and they were ready to pivot and set up the COVID high performance computing consortium, which was really a game changer for across the nation. So that kind of funding and upfront investment and deep investment in the past is really critical to the success that we've had.
Yes, for sure. Kind of along that line, I'm going to pivot slightly because I know we do have a lot of federal staff members who are listening in today. And Jay, you had testified before the House Science Committee last fall about the impacts of COVID-19 on university research. And we've been talking about all the great things our researchers have done. This is also in the context of a global pandemic, though, so we're all socially distancing. Can you and also Susan talk about some of the ways the pandemic has affected researchers? Has it affected researchers equally? Can you check that part?
Yeah, so the short answer is that didn't affect research equally. At the macro level, in last March, we all went home and worked from home. Then at the research level slowly came back. First of all, not everybody went home. The people who actually were involved with the response to the pandemic continued to work right through that time period, including the SHIELD team. The other researchers slowly came back to the laboratory environment, and we have seen nationwide, we've seen no spread within laboratories, which is frankly not hard to fathom. Researchers generally understand safety procedures, and they just implemented the safety procedures associated with this virus. However, this was not even. Human subjects work was very difficult to do. In particular, it was very difficult to do in circumstances where there had to be close proximity between the researchers and the human subjects. So it seriously impacted a number of areas, and it especially impacted the social sciences areas where the researchers had to be close to those subjects. It made it very difficult to do field work because there was very little travel. And anybody who was doing international work, it was nearly impossible to go visit an international site during this time period. We also found interesting impacts on those with parents with young children. So researchers who had young children, it became very difficult. And frankly, this is not just researchers, but nationwide, I suspect. But there was a study done that was looking at researchers, and the researchers with young children, they were seriously impacted, and especially women. They were disproportionately impacted, and you could measure this in a variety of ways. The publications were the easiest and most straightforward way to measure this. The final thing I would say is that the impact on universities was significant in a number of ways, and I'll name one. And that is all major research universities run what are called core facilities. So you put your big pieces of equipment in a core facility as opposed to into an individual laboratory, and you make those pieces of equipment available to anybody on campus. And the way those are funded is that, for example, Susan or Marty will have an NIH grant, and they will use a microscope facility. And when they're using that microscope facility, they will essentially pay that microscope facility for use of that facility. Well, if they're not using that facility, there's no funds flow from their grant into the core facility. So core facilities were seriously underfunded nationwide during this time period because there was no revenue stream for them. But the people who are running those core facilities were still in those facilities or remotely, and you don't want to have to release them. You don't want to have to furlough them or lay them off or fire them. So you maintain them so that you maintain the research infrastructure for the United States. This seriously hurt universities because they had to find funding from within their own institutional funds, whereas previously it was NIH or NSF or DOE or DOD grants that were paying this. So there was disproportionate impact on people and on the institutions.
Thank you. I know we're just over time, but Susan, I want to allow you the opportunity to maybe add anything clever that we at Urbana was able to do to step in and get creative here.
Yeah, and let me, Jay, that was really a great answer and very comprehensive. I will just acknowledge the governor, who early on, when he set up his recovery plan, ensured that essential research could go on throughout the pandemic. And we were able to activate research in agriculture, in the labs, and engineering, and the social sciences and human subjects research, which produced a lot of the innovations that you saw today and much farther beyond. The human subjects researchers, they're innovative. Many of them went and found digital means. Others went and built shielding around their exercise areas or their imaging areas. So, they were impacted on our campus, though, the types of human subjects research we did, we were able to move on in many, many creative ways.
Thank you. Well, that wraps up our program today. Again, thank you all for joining us. I hope you found this helpful and informative. And thank you, Susan, Marty, and Jay, for sharing your perspectives and your expertise. As I mentioned at the outset, this is part of a series of webinars, so please be on the lookout for our next invitation. We've got some exciting things lined up. Thanks a lot and have a good weekend.
Thank you.
Thank you.